Hi everyone, welcome to Follow Your Heart here on the Natural Parent Magazine. I'm Cullen and I'm answering your questions today. The first question I've got is about breastfeeding when you've got longer nipples or larger nipples. Sometimes it can be a little bit tricky in the beginning. You've got a very small baby with a very small mouth and large or long nipples, and it can be a little bit of a mismatch sometimes. So what we need to do, as with any scenario with our newborn babies, is to learn what good swallowing, what good drinking looks like. So no matter what your nipples and breasts are like, we need to understand what it's like when baby is actually taking milk. So that's the first thing to learn about and to watch for. Next, of course, if there's any pain or damage of your nipples, if you're really uncomfortable, then we need to look at changing positioning or looking at what we can do about that. And if it is just the mismatch of the baby and the mom that's causing the problem there. I have actually seen plenty of babies breastfeeding on mums with larger nipples, and the latch from the outside appears to be shallow, but baby feeds just fine. So often it's not as much of a problem as we think it's going to be, but of course we need to be looking at, for those newborns, are there multiple poos a day? How's the weight gain? Is baby swallowing and drinking? And is mom comfortable? So if you're ticking all the boxes there, then it doesn't really matter what the latch looks like or what you've been told about, needing a big full mouthful of breast tissue. It's looking at all those other things that we need to do. Now, if it really isn't working, and it's rare, but it definitely happens, that it's just too much for baby and it's really challenging to have effective drinking, then of course we'll have to start looking at how can we get baby to take the milk a different way. So you might be looking at needing to express or pump your milk, or even use formula if that's tricky in the beginning. And I here recommend using slow methods of feeding baby if you then in a few weeks want to get baby to the breast. So we want to look at slow ways of supplementing rather than necessarily going straight to bottles. You can look at finger feeding, cup feeding. There are plenty of different ways. So work with your professionals, be in touch with me if you want to get some different ideas. If you're really feeling like baby's just not going to be able to latch on, you don't necessarily have to go straight to bottles. And then I would recommend that you continue to make your chest, your breast, a pleasant place for baby to be. Lots of skin to skin, lots of closeness, and giving your baby plenty of opportunities to keep trying. And anytime that they're there and trying is going to be a good thing. And with the passage of time, everything will eventually work out. We just need to kind of protect that breastfeeding relationship. So working with someone one-on-one in that case is quite possibly what you need to be doing. Now, the second one is also sort of a breastfeeding question, because it's kind of about the idea of hind milk and fore milk. And I think I'll go more into this in my video on Monday, so I'm going to keep this one a bit quick. But generally, we don't need to be too worried about this idea of fore milk and hind milk. Babies tend to take about the same amount of milk in 24 hours, no matter what, and they all get about the same amount of fat and protein and calories and sugars and all of that, no matter when they get it. So yes, maybe those morning feeds are less fatty than the couple of feeds right before bedtime at night, and that's okay. It's over 24 hours they're getting just what they need. And if green frothy explosive poos are happening, maybe you want to feed your baby longer on one side and just slow down that milk production a little bit. And the fat globules can stick into the breast tissue inside a little bit, and they are kind of the last thing to come out sometimes. So, if your breast is really, really full all the time because you've got a bit of an oversupply, you're making much more than baby needs, then we just need to slow down that production a little bit. So, but that's more something we're going to consider if baby's weight gain is really problematic, or baby is really fussy and not settled. Okay, so if you have specific questions about a baby in your life, then please be in touch. You can email me at Anne at the Natural Parent Magazine. Remember, I can answer your questions here on the series, or I do private consults, video online consults with anybody. So, you can book something in if you want some more personalized attention, remembering these videos are very general. My last question is about sleep, and this one can carry through to all of your napping age, whatever age children you have. I'm going to suggest that when you have a newborn baby, you start them out straight away sleeping in the daylight. Not bright light necessarily, not in direct sunlight, but we want to get kids used to the difference between daytime and nighttime, set that circadian rhythm, of course. But we also don't want to have them off in a darkened room for their daytime sleeps. First of all, it is protective for baby, at least for the first 6 months, to sleep in close proximity to their primary caregiver or another adult. They should be in the same room as you for all of their sleeps, day and night. So you don't want to be laying off in a very dark room for 2 hours in the middle of the day, and neither should they be. So keep the sleeps in the daylight. This is a very confusing one, and I can see, just doing some quick searching, why parents are so confused about this and not knowing what to do. So set it up from the beginning. If you've already set this habit of your child sleeping in the dark, and then you can just gradually wean them off of that little way of sleeping. So what I would suggest you do is, if you really can't get your child to sleep in the daylight because they've been so conditioned to sleep only in the dark, then I would recommend that you get them off to sleep in the dark, but as light of a room as possible. And then once they're off asleep, then open up your curtains, turn on the lights, whatever you need to do to brighten that room back up, so that then they get used to not staying in that complete darkness. So I've heard of people putting, foil on the windows, using blackout blinds, and really told they must get their baby asleep in the dark, and it's a better way to calm them. And so, of course, if you've got a baby that's just gotten so wound up for whatever reason, not on a daily basis, but at some point they've just gotten really wound up, of course, taking them off to a dark, quiet place can be quite calming for them. So as a way of calming a baby, yes, of course, that is something you can try. But we don't want it to be the thing that we're always doing for every daytime sleep. And certainly it's no way for mom to be. If you're a breastfeeding mom, breastfeeding off to sleep, you don't want to be sitting in a dark room in the middle of the day either. So remember, for the first 6 months at least, all babies' sleep should be in the same room that you are in. Okay, that's just the safest, and we do know that. All the alarms and monitors are not as good as you being near them. So